Healthcare.gov is a great resource, but a lot of people are very, very confused about what Obamacare is, how it works, what you're eligible for, what you have to do, all that kind of thing. And so Wendell Potter's on the line with us. He's a health insurance industry whistleblower, the author of Deadly Spin, his website, wendellpotter.com, answering your questions. Jerry in Long Island, New York, listening to WWRL. You have a question for Wendell?
Yes, I do. Thank you very much for taking my call. Yeah, my brother asked me some questions over the weekend about Obamacare, and I had no answers, but I figure Wendell Potter has some good answers. You know, by sometime in 2014, all individuals will be required to have some form of health insurance. But how will the government, by what method will the government use to figure out who actually has health insurance and who does not, first of all? And also, what about states like Florida that have a medically needy health care payment program? Would that be considered as health insurance under Obamacare?
I'm not sure I understood the second part of your question, but you know, the IRS will be involved in determining whether or not you have coverage or not. It'll be the.
But how would they do that? How would they actually go about that? How would they actually go about that? What method would they use to figure out?
I don't think the first year it's going to be something that's going to be all that heavily regulated, because we'll be trying to see exactly how is the IRS going to be making those determinations. But you know, as it is today, you make some statements as to how much money you're making. You'll have to show some evidence of insurability, or that you're insured. When you file your income taxes is how I would expect that they will do that.
So it would be just like when you file your income taxes, you say, yes, I have 3 children I'm claiming as deductions. You don't have to mail in pictures of the kids. They just take your word for it until you're audited, and it'll probably be that sort of thing.
That's right.
Okay, and then the medical, Jerry, you said Florida has what is
medically needy program? It's medically need. It's a special program for people who have no health insurance. It will give them payments towards their medical bills. And like my sister-in-law is on that program, they might have it in other states. Other states may have other individual state programs for the uninsured. Would that be considered as health insurance under Obamacare?
You sure that's not Medicaid, Jerry?
No, it's not Medicaid.
Okay.
It's separate from Medicaid.
Okay. Wendell?
For people who don't qualify for Medicaid.
Right. Wendell?
Yeah, that I'm not 100% sure about that particular program, but if it's not insurance, it wouldn't qualify. Now, keep in mind that not everyone is required to. Not everyone is required to get coverage. If what you're having to pay for health insurance exceeds 9% of your income, then you will not have to buy coverage. So it depends on each individual or each family's circumstances. And that Florida program probably will continue. I don't know. I'm not familiar with that particular program in terms of whether or not it will be continued, but just know that it would not necessarily constitute insurance.
So if the cost of your insurance would be more than 9% of your income, you don't have to buy insurance. Does that? But what happens when you get sick?
Well, that's one of the flaws in Obamacare. It's not a perfect law by any means. Right. It doesn't get us to universal coverage. There will be people who will be able to exempt themselves if they have to pay more than 9% of their income for insurance. I think even many people who do will opt to get coverage. But again, this does not get us to full universal coverage, and there will continue to be people who will get sick, they'll be uninsured, and they'll be facing medical bills that they'll have to pay out of their own pocket. It's something, we've got to do a lot more than implement Obamacare. That's what comes next, is to get us closer to universal coverage.
Sure, I'm with you. Tim in Anoka, Minnesota, you have a question for Wendell?
Yeah, hi. Thank you very much for taking my call. The question I have is, I'm a 100% service-connected veteran, and I have several friends who are also service-connected for their in-service disabilities. Some of us have received a form recently asking us to fill it out that requires us, according to the form, to give entire financial histories or statements, or what would you call that? A net worth, assets, things like this. I don't understand why this is happening, and what purpose it would serve. And the second part of the question is, a lot of my friends also still have Medicare Part A and Part B in addition to the VA coverage. Are we going to be able to keep this?
Yes, it does not affect Medicare Part A or Part B by any means. You still will be able to keep your Medicare. Keep in mind that people who are on Medicare. Let me step back a minute. 9 out of 10 of us will not really see much effect from Obamacare. That's because the vast majority of us who are uninsured get it to the workplace, and there are minimal changes that will be in effect that will have any bearing on people who are like me. We get coverage to the workplace. Another about a third of the population already gets coverage through Medicare and Medicaid.
Okay,
that's not going to change.
That's all well and good. But then the main question is, why are we receiving these forms from the Department of Veterans Affairs asking us for financial statements?
I don't know. I'm not sure that it. My mother gets benefits from the Department of Veterans Affairs, so I'm not sure. I haven't seen that until I actually saw the form. I wouldn't know because I haven't seen that form yet. But more than likely, they're just wanting to make sure that you're continuing to be eligible for your VA benefit. It doesn't. Obamacare does not change your eligibility for a VA benefit.
So there's no relationship between Obamacare and the Veterans Administration?
No, there's none at all. Because, again, there are a lot of people who are already in government-run health plans, Medicare, Medicaid.
And they will stay in those programs. Okay. Tim, thank you for the call. Wendell, thank you for the info. You can stick around with us another half hour, Wendell, and answer questions?
I sure can.
We've got a bunch of people calling in here, so we will be back with more in about 5 minutes with more of your calls for Wendell Potter. Be sure to check out his website. In the meantime, wendellpotter.com.